Hi guys, it seems Grant Shapps isn't the only Tory who's interested in using video to get his lies across. The current Health Secretary Steve Barclay put this short clip on Twitter which seems to include some misinformation. In the tweet he says that he visited Stamford Hospital, which you can see him standing outside of. Then he said that the team is doing a fantastic job reducing ambulance handover delays. There's just one small problem with that.
It's great to be able to pay tribute to the fantastic team here at Stamford Hospital, and in particular the step-down provision at the Jean Van Gies ward, where there's 22 patients able to get them out of hospital where they're medically fit to be discharged, but they need some further support which community settings like here at Stamford are able to provide. It's part of the challenge we need to address in terms of getting ambulance handover delays down, is to get those patients who are fit to discharge out of hospital, and community settings like this play a key part, and the team are doing a brilliant job.
Okay, so what is he talking about here? What is the problem? The problem is that at the moment there is a lack of staff available in the care sector, in care homes, and there's not enough staff available to provide care for people in their homes. Because there's a lack of staff available, it means that many people who are in hospital at the moment can't be discharged into the social care sector because of the lack of staff. Now, there's a lack of staff because of both Brexit and because of the pandemic. So what's happening is hospitals are holding on to patients longer than they need to. These people are medically fit to be discharged, but there's nowhere for them to go. And it's also creating a backlog at accident and emergency, A&E, which brings us to this tweet here. It says here that he wants to thank the staff for reducing ambulance handover delays. So an ambulance handover is when the ambulance arrives at A&E, accident and emergency, and hands over the patient to that department. As I said, there's a problem with that. If you Google Stamford Hospital A&E, you'll see one of the first questions is, does Stamford Hospital have an A&E department? It says, when the surgery is closed, an out-of-hours service is provided for urgent medical advice and attention at Stamford Hospital until 11 p.m. and then at Grantham Hospital until 8 a.m. The surgery emergency line is available from 8 a.m. Monday to Friday. So there isn't really an A&E department at this hospital, it seems. Now, this may have changed since I found this information. I hope this information is changed, because the Health Secretary is saying that ambulance handover delays have been reduced. But how can you hand over patients from the ambulance if there is no A&E? Where are these patients going? How can you hand over patients from an ambulance to an A&E department if there is no A&E department? Is Steve Barclay lying here, or am I confused? Which is it? Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.